Good morning or good afternoon, everyone, and welcome to this webinar. Thank you for joining us today. This webinar today is on making public finance management work for social protection, and we are going to deep dive into country examples in Nepal and Senegal. So this webinar is organized by the Social Protection and PFM team, led by ILO, UNICEF, the Global Coalition for Social Protection, FLOR, and the European Union. And this is under the joint multi-country action on improving synergies between social protection and public finance management. This is the famous SP&PFM program, Social Protection and Public Finance Management Program. I hope you all heard about this program. Huge thanks to socialprotection.org platform, who greatly supported the organization of this webinar. So let's now present our rich agenda of today. So today we are going to have 3 blocks. So after the welcoming remarks, we are going to have the first block, which will be led by Tomo and Celine on presenting our approach. Then the second block will be deep diving into what we've been able to achieve at country level in Senegal, then in Nepal, and then at local level with the Global Coalition for Social Protection FLOR. Then at the end of the webinar, we will keep time for us, 40 minutes to learn together, to answer the questions and discuss ways forward. So before starting, I would like to have some few housekeeping rules. So first, we will be asking all participants to use the Q&A box to ask questions and interact with the presenters, or maybe to express their views and opinion. All questions will be addressed during the Learning Together session. So this means after the presentations. We will have 40 minutes for that. So please state your name and your organization, and please also let us know if you have questions that are directed to a specific speaker. Now to quickly introduce myself. My name is Aristide Kielem, and I'm a social policy specialist working for UNICEF, and I coordinate the SP&PFM program on UNICEF side. I'm based in UNICEF headquarters in New York, and I will have the pleasure to roll out our interesting agenda today. Please participate to the discussions. This means to be interactive. We'll also ask all speakers to switch on the cameras during the presentations. So for our discussions today, we are lucky to have the welcoming remark by Dr. Bosse, who is the head of sector for horizontal coordination on social protection and disabilities at the European Union Directorate-General for International Partnerships, what we call the INTPA. She brings in over 20 years experience in development policy and development cooperation, 20 years during which she worked for the German Ministry of Economic Cooperation and Development and led teams in INTPA headquarters and in EU delegations on the field. Then we are going to have 3 presentations, and the first session will be led by Tomo and Celine. First, who is Tomo? Tomo is leading UNICEF global work on social protection system strengthening, and also what we are doing in UNICEF on cash expansion. And he brings with him solid experience from Mozambique, Nepal, Sierra Leone, and Thailand. So then he will be giving his presentation with Céline Perron-Bista, who is the Chief Technical Advisor for this joint program, working for ILO headquarters in Geneva. Céline is bringing a huge experience to this joint action with over 20 years experience in social security and social protection. So the second part of the webinar will be on country deep dive and country experience. So the first presentation will be given by Alex Macham, who is a member of the ILO's global technical team on social protection. She's working on Senegal, Gambia, Capo Verde, Guinea, and Guinea-Bissau. Then we will have a presentation by Usha Mishra, who is the Chief of Social Policy, Evidence Generation, and Evaluation at UNICEF Nepal. That's a position she also held in Cambodia, Tanzania, Afghanistan, and Nepal, and she authored major publications. She will be driving us into Nepal's social protection financing model. So the last presentation will be led by Bart Verstraeten, the General Director of We Social Movement. Bart is bringing a cutting-edge experience in non-governmental organizations, in NGOs. He will be giving the presentation with Uziel Twagilimana, the Deputy Director of Programs of WSM. So Uziel and Bart are members of WSM, and with LPage and Oxfam, they are all part of the Global Coalition for Social Protection Floor. This means the team that is implementing this program. Thanks to all our speakers, I think it is now time to welcome Mrs. Dr. Bosse for the welcoming remarks. Doctor, the floor is yours.
Thank you very much, Aristide. I hope you can all hear me. Good morning, good afternoon to everybody, and thank you for the interest in our webinar series here. Look, first of all, let me thank you to, as already mentioned, our implementing partners, UNICEF, ILO, the Global Coalition for Social Protection Floors, and as well the socialprotection.org website who co-organizes this event with us. Thank you very much for setting up this webinar series. Perhaps before I talk about the program, like a quick background, because I simply find this very important to put it in the against the background, what we are doing with our, what you already mentioned, Aristide, famous thematic program, which is on linking social protection and public finance management. So as a first one, so of course, we all know social protection is a human right. So we have to always recall that it's a rights-based approach, first thing. The second thing is we have seen, especially now to COVID, that no country can afford not to have a social protection system. Simply, it's much cheaper, so to say, to be prepared than dealing with the aftermath when crises occur. I think as a quick reminder here as well, we have seen with COVID-19 how important social protection schemes have become over the time. I think COVID-19 resulted in an unprecedented global social protection response. So we have seen to what governments are, what can be done, right, in order to support people around the world, in so very different levels in the different countries, what we have seen worldwide. In detail, perhaps we can say we need to push much stronger in order to achieve universal social protection. More in detail, we have seen that special focus need to be put on shock preparedness, as I just mentioned. We simply need to make sure that more people are covered. As mentioned in the most recent documents, again, 55% of the population worldwide does not even have access to one instrument of social protection. We need to have a better coverage of informal people working in the informal economy. I think we all have these images in our heads, what happened, for example, in South Asia when COVID hit. We need to have a better coverage of refugees and migrants. They're very often just for the cracks when it comes to social protection coverage. We need to use a better use of digital solutions. We have seen with COVID-19, that's a very positive and exceptional boost of using digital solutions when it comes to registration and service provision. And just to conclude on what we have learned to COVID-19, which in a way we knew already before, we need to be better prepared for the future so-called mega trends, which regarding social protection when it comes to climate change, increasing inequalities in countries, among countries, changing world of work / automation, financial system crisis, as we have seen in the past as well, other pandemics, which are surely on the horizon, increase of the number of federal states, the overall aging worldwide. Okay, those are the mega trends, so it all looks a bit not too positive. So in other words, we really need to be prepared. Countries, governments need to be prepared. Societies need to be prepared in order to have a response to these mega trends. So going back to the program. So we have this thematic program linking social protection and public finance management. We're almost halfway through, so to say. By the way, we're doing a midterm evaluation right now. This is a program of 4 years of 22 million euro. And as I already mentioned, we work with ILO, UNICEF, and the Global Coalition. It's a twofold approach, so to say. So we support countries in the design and in the design of social protection programs at national level. Currently, we are supporting 18 countries and more to come. And then we help them, of course, as well with the implementation, having an eye on shock responsiveness as well. And there's an inbuilt shock responsiveness element in what we are doing. And then apart from the so-called country cases, short and midterm support, we are elaborating already overarching best practices. So based as well on the country studies, because you should not forget it's a thematic program. So it's not a multi-country program. What we want really is to generate best practice, what then we can feed in what we are doing and all the programs we are supporting, and as well to the international discussions. What are the lessons learned from the program? What could be useful for other countries, right? So, and we perhaps just as a reminder, apart from the thematic program, we support many, many countries, roughly 30 countries right now, partner countries, in building their social protection programs through our so-called geographic programs. Yeah. So, and just perhaps as a concluding on this thematic program here is, it's obvious that like all of us being working on development, COVID hit hard as well on this program. So we really had to adapt as well in the course of the implementation what we are doing there with short-term responses. That's just a quick reminder, and almost coming to an end because I only have 5 minutes. I want you to understand why we had chosen to link social protection and public finance management. So very often we have observed that on one side, we have the people working on sector, so social protection, and then I have the other people working on financing. I'm talking here about the development community, right? So we wanted to bring both people on one table. Sometimes, of course, we observe this as well in our partner countries, but I think it's quite typical for the development partners community as well. So we need to make sure that both are linked. And perhaps just to remind, because not everybody who's interested in social protection might understand what PFM is about. It's 3 ingredients. First is aggregate fiscal discipline. So this means interaction between revenue and expenditure and the objective of macroeconomic stability and long-term sustainability. That's logical. If you don't have macroeconomic stability, it's difficult to foresee what is the income, what should be the spending for social protection. Secondly, strategic allocation of resources. Again, that's logical. If a country declares that social protection is a priority politically, there need to be funds attached to it. This is what it is about. Third one, almost coming to my end here, is efficient service delivery. So of course, this is very relevant again for social protection as well. We need to make sure that we know how social protection services are delivered. This means at central level and at local level. Those are the 3 kind of layers of PFM, and they can perfectly be connected to what we should do in social protection at the different levels. So so why we're here today, I think this was already mentioned. So we have this webinar series. Again, big thanks for organizing this. I think this is part, I mean, of course, of our program to kind of pass the message, what we are doing. It's kind of a multiplier effect as well to inform people what we're doing. It's kind of a lobbying as well. If you're interested more, join us. So, and I understand as well that here today, of course, we have the very good country cases. Those are 2 countries we are working with. And thanks for the colleagues for being here as well. that were just presented. So we wanted to show you as well what we do in Nepal and in Senegal. And on top of it, I mean, from linking social protection on one side and PFM on the other, it's very interesting as well for those two countries, Nepal and Senegal. And this is really innovative of our program here. We bring in social society. I think that's a very innovative layer, again, apart from linking social protection and PFM, bring in social society that they have a say in the planning, in the implementation, in the monitoring on what we are doing. I thank you very much, and I'm thrilled to listen to your presentation. Thank you very much.
Thank you very much, Doctor. And I see we have a large audience and diverse one, so I think the discussions will be interesting, especially the session on learning together. But with no further ado, I will hand over to Tomo and Celine for an overview of the SP&PFM program and how the vision of this program fits within the challenges that we just heard about. Tomo.
Thank you so much, Harrison. Hi, everybody. Good morning from Thanksgiving Day here in New York. I have many things to be grateful in my life, but one of them certainly is the opportunity to be part of this really innovative and excellent program. So I'm really excited to give an introduction together with Celine from ILO about the overall program. And actually, Duarte just gave a fantastic overview. So I'm left with very little to add to it, but let me just go through 3 things I wanted to share. One is what brings us together, why we are here. Second is where we want to get it, our vision. And then third is about how we get there and what are the key features of this joint program that are very innovative. So I'll run through all of the 3 very quickly. So this is the first one that gives really about what we know and where we start. One thing that clearly brings us together is the fact that social protection, and we all believe that is a human right. It's an economic necessity. It's also a smart investment and a catalyst to achieve many SDGs beyond SDG on ending poverty and reducing inequality. Despite it being a right and so many benefits of it, we know that the coverage gap is huge, leaving 4 billion people without any social protection, particularly the most vulnerable population. And as Dorothy really outlined clearly, the world and countries and the most vulnerable people are facing incredible amounts of increased vulnerabilities coming from COVID-19, conflicts, or climate change. And the recovery, especially from COVID-19, needs to be built from in a human-centered design that brings families and people and children at the center of the recovery. So we have a shared vision to challenge all of these, to address all of these challenges that I mentioned before. We follow the rights-based approach that will be a core underlying principle, and also following other key international principles that are adopted around social protection and public finance management. Second, our vision is achieve universal social protection, where a world that everybody is protected from any shocks and can have a minimum standards of living, with a focus on leaving no one behind, and particularly the most vulnerable population, and taking a life cycle approach, considering how people face different vulnerabilities and risk at different stages of their lifestyles. We take a systems approach, meaning that we don't focus only on individual program, but we try to build that together as a social protection system and ensure that what is built is sustainable, it remains there, and it is a long-term change that we're making for. We are very conscious of the shocks, and which leads us our effort to be adaptive to respond to shocks. And on public finance management, we believe that increased investment is just necessary. We need to invest more, of course better, but increased investment is a key step to achieving that, in fulfilling the gaps of coverage. And the public finance management, the 3 elements that Rote just mentioned, is such a key to achieve all of these vision. And that's why the program is really emphasizing the synergies between social protection and public finance management. This is a key feature of the program. First, it brings together 4 organizations and coalition that have shared this vision and have committed to work together to achieve this ambitious goal. So between EU, ILO, UNICEF, and the global Coalition for Social Protection Floors. It has a global scope, so there are countries in all regions that are working on this issue in their own nationally contextualized way, and that would generate a set of knowledge and experience that can be applied to other countries. The key principle is also based on broad national dialogue, so it should come from a dialogue between government, civil society, and international development partners to get to a solution that is sustainable. We aim to really get into the key topics of social protection and public finance so that we can develop and generate cross-cutting edge knowledge, whether it is on covering people with disability, informal workers, children, or gender responsive and gender transformative social protection. We do want to get to the most difficult challenge and then pull out the key evidence that emerged from the experience and countries' efforts. There's strong link to public finance management, as mentioned earlier. And then at the beginning of the program, there was no foresight of COVID-19 happening and affecting the program so much. But the countries and the program has been very adaptive and agile to adapt to it, and also to draw lessons learned that what happened to COVID-19 and what is that implication on social protection coverage, as well as a linkage between public finance management and social protection. This is my last slide. There are two approaches, just to say, of this program, which also is a unique feature of this program. So under approach 1, which looks at 44 months, which is a bit more midterm, and then there's approach 2, which is an on-demand technical support that has a more short-term focus, specific focus on response to COVID-19. So I won't go through the list of the countries, but you can see that in 8 countries under approach 1, and then there are countries under the first and second call under second approach 2 that are receiving on-demand technical support. So from here, I'll pass it to my colleague Celine.
Yeah, thank you, Tomo, and good morning, good afternoon to everyone. Thank you very much for this very great overview of the program through also Dorte's opening remark. And now we would like to zoom a little more in one of the particular issue that Dorte mentioned in her remarks, is the link with PFM, including with the financing for social protection, because the latest figures show that one of the drivers for low coverage on social protection, it's still an underinvestment in social protection, with a gap in the low and middle income country of 3.8% of GDP that still need to be added. And if we look just at the situation in sub-Saharan African, a region where the investment are also the less on social protection, we still need additional efforts of 8.2% of GDP, which is quite challenging in the economic context, and also this challenge has been reinforced by the crisis linked to the COVID and some possible austerity measures that the country may have to adopt to recover from the COVID. Next slide, Tomo, please. Here is just one example of the discussion that we're also having on improving the financing and the sustainability of the system. One emphasizes really on helping countries and building capacities of the countries and constituents to explore domestic resource mobilization options. There's a large branch of different options that can be explored. Among themselves is also the extension of the formalization that will also allow to extend resources for social security and then social protection. But also an area where the project works a lot with the countries on improving the budget efficiency, improving this public finance, overall public finance management framework, to ensure that also the budget allocated for social protection, as Dorte insisted in her remarks, really are delivered to the population. And a discussion that is happening and has been accelerated or reinforced with the COVID response and the large amount of external funding reaching the countries to support their response to COVID is how do we link the international finances, the international aid, how do we link this to efforts at national level to increase domestic resources? And how do we tap in this potential created by the international aid to indeed mobilize those domestic resources? And one example is shown here in the slide, that even looking at the role that can play SDR to increase the revenue for social protection. The last slide of our joint presentation will be to give you a bit of an overview of how do we link social protection and public finance management through the project, and looking a bit at the process that we're following with countries to come to sustainable solution for social protection systems. What is really important, and maybe innovative, or maybe a particularity of this program, is we really base all our financing discussion on a very sound diagnostic of the situation, diagnostic of the current social protection system through inventory of program, collecting statistics for baseline information, and diagnostic that are also based on national dialogue, as Tomo mentioned, which is very important for us to have a consensus on the gaps, good identification and strong consensus on the gaps that will bring also to a consensus on the priorities. And when these priorities are defined, it's a matter to cost, how much it will cost to achieve these priorities, and also to look at the poverty impact that the different options to fill in these gaps will have. And this is what we have in the first block as evidence to help designing national social protection priorities and policies, with a special attention to the vulnerable group, such as people with disability, women, children, informal economy, migrant workers, and refugees. Once these national priorities are established, the question comes to know how we're going to finance the implementation of this strategy, of these priorities. And here the discussion on financing and defining, formulating financing strategies, again, based on very sound evidence, which comes through fiscal space analysis, but as well as an assessment of different financing options. As I mentioned, domestic resources, as well as extension of social insurance, to see how it can be linked also and make more efficiency of the external funding as well. And an important area that was also mentioned by Dorte is really the extension of the coverage to the informal economy, both for the human right perspective, it's still the missing middle excluded from the system, but also as a way to improve the financing for social protection. And here, some important work also on improving the compliance with social security laws. The third step is the adoption and the execution of the national budget. And this is where we're looking also at helping the governments to improve the budget cycles, improve the classification of social protection expenditure with a gender lens perspective, and also, as Dorte mentioned, the importance of improving the delivery of the social protection spending and services, including at the local level. And the last step will be to improve the monitoring of those social protection expenditure, improving the monitoring of the results and impact through transparency and accountability mechanism, improve statistics on budget, so social protection expenditure review, and also statistic on the performance of the programs and the institution. And all of this will feed back into the improvement of the national social protection strategy. I will stop here. It's a lot of information, but we would like also to hear from Senegal and Nepal and concrete experiences and the work that has been done in the countries. Thank you very much. Aristide, back to you.
Thank you, Celine, and thank you, Tomo. And as you see, this program is quite ambitious. I now realize how ambitious it is becoming, right? So, and you will see also that the structure of this webinar is reflecting the way the program is designed. We had the first section on the overarching vision of the program. And then we are going to deep dive into countries. And the third part will be we are even going to go at local level with what we do at local level. And the last part will be how we share experience, how we discuss and generate evidence, discussion, and feed into the international debate. So let's go now to the second part of the webinar on country deep dive. And I will give the floor to Alex from Senegal to talk about how we were able to systematically identify sustainable financing options for Senegal. Alex, à toi.
Thank you so much, Aristide. Good afternoon to everyone. Thank you for attending today. It's really a pleasure today to be able to be here and introduce to you Senegal's experience in identifying financing options for social protection. So without further ado, let's dive a little bit into the process that we followed to identify these options. And I believe Celine already touched upon it a little bit. So I will skim through it quickly. So just to remind you, it is a 6-steps process that is based on a quantitative, qualitative, and financial assessments. And throughout the presentation, I will go a little bit in depth into each step and the way that it was applied in Senegal. But what's really important to mention and remember here is that all of these 6 steps are always supported and underlined by a constant process of social dialogue and capacity building around the results as well as social protection. So concerning social dialogue, what has to be said is that this process, so the 6 steps process, it follows what is called the assessment-based national dialogue methodology, which really aims at engaging stakeholders in a national dialogue. So typically what we do is that the process starts with the constitution of a national group, ideally involving Ministry of Finance and placed under a line government leadership. So in Senegal, what we did is we had 2 working groups. One that was a technical committee and that really involved a wide variety of stakeholders and actors concerned by social protection. So as much government, line ministries, as well as social partners and civil society actors. And then we had a restricted technical group that really focused and supported the whole process. And this working group included key ministries working on social protection, including Ministry of Finance and the ILO, of course. So this 6 steps process, it relies on what we call the Social Protection Policy Option Tools, SPOT. They are tools that were elaborated by the Interagency Social Protection Assessment Group. So they're interagency tools, and they really provide a coherent framework for us to analyze a social protection system on 3 levels. So the system level first as a whole, and then the scheme, the program level, and then into the delivery level. So before I move on to describing the 6 steps of the process, I would like to tell you a little bit more about the context of social protection in Senegal. It's really important to mention that the Senegalese government considers social protection as a critical element of its socioeconomic development. And as such, it views social protection really as an investment rather than a financial burden. And this vision is translated into the National Social Protection Strategy, which is divided into 5 strategic objectives based on the life cycle approach. And this is important to mention because the strategy really creates a framework for us to engage in the process of identifying financing options. And having this political support really gives impetus for a national dialogue to happen around social protection. So when it comes to implementing this strategy, one of the priority challenges is, of course, securing resources, because implementing this strategy, it's going to require the extension of existing programs, the implementation of new programs, and of course, for that, you need resources, and you need to acquire them through a sustainable financing mechanism, but also by improving public finance management. So in Senegal, the objective that was set in relation to this is that of reaching at least, allocating at least 7% of GDP to public social protection programs within the mid to long term. So now let's have a look at each step of the process. The first step is the inventory of existing schemes. So in Senegal, the government conducted an overall review of the social protection system, and that was done in two steps. First, an analysis of the population's social protection needs based on demographic and socioeconomic context, and then a mapping of the social protection system in terms of its legal and political framework, and then existing schemes and programs, as well as the institutional framework, that is to say, the whole architecture of the system. So that was done using the ILO Social Security Inquiry database. It's a database that is available online and which provides statistical data on social security programs and social security expenditures worldwide. So once we have identified these needs and once we know what the system as a whole looks like, we move on to assessing gaps in the system. And those gaps, they're identified in relation to the 5 objectives of the National Social Protection Strategy, to which we added access to healthcare. And we look at gaps in terms of legal coverage, effective coverage, implementation, as well as the adequacy of benefit levels. And once we have identified these gaps, recommendations were formulated to introduce new benefits and strengthen existing benefits on one hand, and then on the other hand, improve the whole architecture, efficiency, and delivery of the system. And here it's really important to mention that these recommendations, they were formulated by the National Working Group based on national dialogue through a series of workshops on the topic. So the tools that was used for this gaps analysis is the core diagnostic instrument, and it provides a framework for you to assess social protection system performance in a comprehensive manner. So the way that it works is that you have an assessment table to rate 18 key areas of social protection, policy, program design, and program implementation on 10 performance criteria. They are listed here on the left, and they include adequacy, governance, responsiveness, cost effectiveness, etc. So the recommendations that I mentioned now at step 3, which is the costing analysis, they are transformed into scenarios by the working group, so extension scenarios. So we obtained 24 scenarios in total, and the cost of each scenario was evaluated over a 10-year period. So maybe here the word scenario is a bit confusing. We could also refer to them as programs, so extension programs. And then based on a cost versus impact analysis, the working group selected a combination of 6 optimal scenarios or programs that are going to come together and define a social protection floor for Senegal. And the resulting floor would represent 1.6% of GDP by 2025. So this number seems quite small, but it's important to mention that only represents the cost of the extension, not of the whole system. So the tool that is used to do the costing is called Rapid Assessment Protocol. And it's a very simple projection model. It's Excel sheet based that helps you estimate the costs of a social protection floor. That is to say, of introducing one or more elements to the social protection system for the next 5 to 10 years. So now we know which gaps are to cover in order to establish a social protection floor for Senegal. We also know how to fill these gaps. We know how much that would cost. So now we would like to know whether it is affordable for Senegal and how Senegal can finance these costs. So first, what we did is to estimate current levels of social protection revenues and expenditures to see whether there is fiscal margin for Senegal to create this fiscal space for social protection. And the answer was yes, and that is partly because there has been a consistent, strong economic growth in Senegal, about plus 6% annually. And so now we know that there is a fiscal margin for that. We move on to assessing 8 financing options in the Senegal context. And based on this assessment, the working group selected 3 financing options. based on their adequacy to the context as well as their ability to generate resources. And for each option, experts suggested budgetary measures to free up space, fiscal space for social protection. So that is, for instance, levying new taxes or redirecting certain subventions or using new resources such as revenue from petrol, gas, etc., depending on the financing options. So we arrive at 20 measures in total for these 3 financing options. And for each measure, we then assess the amount of resources that would be mobilized if these measures were implemented. And what the results showed is that applying these measures would generate an additional 520 billion CFA from year 1. And this amount is expected to increase annually. And looking at that, so public spending on social protection would then amount to 5.9% of GDP from year 1. So from the first year of implementation of these measures. So just a quick word here regarding the financing options, because it's really a key topic of today's webinars. Here, we used a guide. It's called the ILO's Fiscal Space for Social Protection Handbook, and it provides guidelines for you to assess these financing options in a specific context. So it lists 8 financing options, which are options recommended by the United Nations systems, as well as international financial institution based on a global review of measures that are implemented in order to increase fiscal space and finance social protection. So for Senegal, the measures that were selected were the reallocation of public spending, the increase of tax revenue, and the increase of social security revenue through the extension of social security coverage. So now we know that there is scope for Senegal to increase the fiscal space. And we know that the objective of devoting at least 7% of GDP can be achieved in the mid to long term. So what would we want to know now is what would be the impact on population? Because of course it's an investment. So you would like to know what will be the impact of your investment before you make it. Here there is a tool that's being developed by the ILO. It's called the Poverty Impact Assessment Tool. But when we conducted the study, this wasn't available yet. So we used a micro simulation model that's called Commitment to Equity. And we were able to run simulations to measure the impact of integrating these programs, 6 programs that were selected by the working group, into the system. And what we see is that this integration shows positive impacts on poverty, on revenue growth, as well as inequality, compared to the base situation, that is to say, a situation in which nothing is changed, no new programs are implemented. So what we saw is that there is space to finance social protection, and this would have a positive impact on poverty, inequality, and revenue growth in Senegal. So what we're going to do now in step 6 is really take all of that evidence-based and leverage it to inform policymaking as well as improve public finance management. So what has been done in Senegal in that regard so far is that we worked with government to define the scope of social protection. That is to say, what is considered social protection, what is not, based on the inventory that I mentioned earlier, as well as international standards, including IMF standards. And based on that, we can improve the classification system of social protection expenditures in the budget to allow for better traceability, trackability, as well as comparison across countries and across years. There's also a gender-sensitive social protection expenditures review in progress. So last few words here, the results of step 1 to 5 are reported in 2 studies that are available online if you would like to access them. And last few words, again, I think really the key message here for Senegal is that it shows how it is possible to conduct fiscal space analysis in a really comprehensive and participatory manner. But for this, you need the exercise to be based first on evidence, and evidence based on coverage gaps analysis, costing analysis, and poverty assessment, poverty impact assessment. It also needs to be based on national dialogue, ideally involving Ministry of Finance, but also a wide variety of actors. And finally, it should be based on internationally recognized principles, approaches, and tools and methodologies to provide really this coherent and reliable framework for the whole assessment. So thank you so much for listening, and I'm looking forward to answering your questions at the end.
Merci, Alex. Thank you very much. And I would like to invite all of you guys to go into the Q&A box and then interact with the presenters, ask some questions. This will feed into the next session on learning together. So to come back on what we're listening to, we still deep dive into what countries are doing. And Alex has given a strong example of Senegal. Now we're going to Nepal. So Usha will drive us into what Nepal has done in terms of influencing social protection financing through a strong foundation of evidence. Usha, the floor is yours.
Good morning, good afternoon, and welcome again to this webinar. Thank you so much, Aristide. It's a real honor to be here with this panel and share some experiences from Nepal. Just trying to set up my presentation. So the topic of my presentation is enhancing investment in social protection in the context of a crisis. And crisis in this case is COVID-19. Can you see my presentation now? Is it visible?
Yes, we can.
Yes, please.
Okay, great. So I have written this presentation jointly with my colleague, Dr. Aniruddha Banerjee, and we are working for the social policy section in UNICEF. So again, thanks. Just in terms of a bit of introduction, Nepal is actually quite a unique country in this context, and I wish I could project a global or a regional comparison, and you'll find that Nepal is pretty much one of the leaders in terms of the investment which is going in social protection vis-a-vis its socio-economic status. In South Asia also, it's one of the leaders. And so social protection as a development strategy is very, very well entrenched within the policy framework and within the vision that Nepal has for itself. So that's a bit of a background. So we do have a bit of policy conducive environment, right? So the idea is how do we kind of leverage that? And I'll come to that when I come to the policy imperatives. So let me get started on this presentation more systematically. This does appear to be kind of very neat on the slides, but believe me, policy advocacy and policy influencing is not such a neat exercise. It's certainly not a linear exercise, right? So we have got to be opportunistic. We have got to constantly scan the environment, readjust our plans, and in fact, make new plans, make new alliances, respond to the imperatives as they emerge in the environment. But overall, our thinking, our planning, and our response is definitely guided by the fact that we need to understand what's happening within the budget. So the budget analysis is pretty much the core of that evidence-based advocacy, because a budget speaks about the government's priorities, one, and then budget allows the government to invest in the areas that we are interested in. So it's important for social policy and obviously for development partners to strengthen their engagement in budgets, which is one of the most important national policy instruments. And I think it's very much within that understanding that this SP&PFM program was conceived. And in Nepal, we are very fortunate to have actually 2 EU-supported programs. So we have this SP&PFM, which under the platform of which we are congregated here, but we also have a public finance for children project. So many of these results that you will see here, the products that you will see here, actually borrowing from these 2 very important partnerships that we have with EU, and then obviously within that with ILO and with WSM. So overall, at the heart of the advocacy and the evidence is understanding the budgets, where these budgets are going, what is the role of the central government, what is off budget, what is not off budget, what is the role of the ODA, and also finally, what's happening at the subnational level, because Nepal is federalizing, which means that increasingly states are coming up with their own social protection programs, which also implies that our budget analysis should not only be cognizant of the federal investments, but also the subnational investments. And that has kind of added an opportunity as well as a challenge for the continued advocacy, which means it needs to be multi-layered. So again, talking about the strategy, because my presentation is very much focused on how do we use the evidence. And there's a lot of evidence that we have produced, and I'm very happy to kind of, leave with you the links and the list and guide you to where they are. They're all available on UNICEF Nepal website, but I can give you specific links in the chat as we go through question and answer. But to suffice it to say that what we recognized is that this advocacy for greater investment in children and in social protection should not be a standalone advocacy being led and implemented by a social policy team only. It really should become everybody's business, because we are looking at a child from a whole individual perspective, right? If the whole idea is about enhancing the impact of the cash transfers, then it's very important for the quality services to be available. Similarly, investment in social protection will also have results for nutrition and for education, so on and so forth. So it's very important that we recognize that social protection is everybody's business. And hence, a lot of our advocacy efforts were not only delivered by the social policy team, but are also integrated within, say, our program technical working groups. So for example, UNICEF leads typically the technical working groups in health and education in many countries, right? So we ensure that we work with these program chiefs to kind of embed some of the key important messages. Also to say that in the context of COVID, to strengthen the evidence base and to ensure that children were very much at the center of the national thinking, the national recovery efforts, because remember, COVID was obviously first seen as a health pandemic, which obviously it is. And so a lot of attention was towards addressing the health-related risk, the expansion of the health system, the strengthening of the health system, the vaccination. Second was, there were certain demographics who were more vulnerable. So a lot of attention was there on the elderly. And then it was about those with comorbidities. And in the initial stages, people had forgotten about the impact on children and those who were already vulnerable. So the existing poor, the existing vulnerable, and especially children and women, that was kind of forgotten. And hence the whole idea was that to understand the impact of COVID-19 beyond a health emergency. So we started saying that, okay, there's a secondary impact, but how do we understand that better? And those were the days of lockdown where monitoring missions had been suspended because of obviously challenges around physical movements. So we came up with this instrument of telephone-based nationally representative survey, which tracked the impact of COVID-19 on multiple dimensions: water and sanitation, nutrition, health, education, risk behavior, child protection, COVID safe behaviors, social protection, responsiveness of the local governments, but just a few, and obviously job loss and income loss. So that was one, and we used that evidence obviously to then kind of also strengthen a case for maintaining the investment in social protection. So during the context of crisis, the evidence on families suffering because of income loss, because of food insecurity, and aggravation of other deprivations became pretty much a very important body of evidence to strengthen our advocacy. So that's I definitely want to kind of emphasize that a renewed, dynamic, relevant body of evidence, because many of the arguments around social protection were kind of well known. Remember, in Nepal, social protection agenda is fairly strong. So, and just a reminder of how strong it has been. We see that there has been a gradual increase in, and a pretty steady increase in, for example, the percentage of budget which has been going to social protection. So starting with 8% in 15-16, now it stands at 12% as part of the budget. Similarly, we see that as part of GDP, starting with 3% in 15-16, it's 5% of GDP. That many of you would recognize as quite a healthy percentage. Similarly, we see that there has been a recent kind of an upward trend in the rate of growth of social protection investments, and in real and in nominal terms as well, the overall amount of money which has been going to social protection has been increasing. That also results into increase in the number of beneficiaries. Overall, we can say that we can safely say that about 15 to 20% of Nepal population is covered by social protection cash transfer programs, and there are about 6 cash transfer programs. So that's all great news, right? Now, but what are the challenges? And that's where we come in, because if the social protection was all perfect, perhaps we would not have to invest so much in evidence generation and advocacy. So obviously the system is not perfect. And one of the biggest challenge of the system is that it is iniquitous, especially vis-a-vis the life cycle related vulnerabilities. And here is a telling example. So children in Nepal form 35% of the population, right? But when it comes to the investment in social protection, it's just about 6% of the budget. So almost 50% of the budget of social protection goes to elderly, which is 70 and above for most of them, and 60 and above for those who are from the so-called marginalized castes, or the Dalits, as we call them in some parts of South Asia. So there's a huge imbalance when it comes to that. So equity, and because of equity, and because there's no strong relationship with what the needs are along the life cycle continuum, the effectiveness and the efficiency would also be compromised. So these are some of the challenges, and there's also a kind of a challenge that I'll come to later on. If we look at how the social protection budget has been allocated across the 7 provinces or 7 states in Nepal, we see that the relationship between the poverty rates and the per capita allocation of social protection was also not that strong. So there was equity, efficiency, effectiveness, and all those challenges remain. Now, why this challenge is important, especially the one around life cycle, is because Nepal, believe me or not, is a rapidly aging society. And in fact, some estimates tell us that it's aging at a rate faster than Japan did in 60s and 70s. So which means that the window of opportunity, the demographic window of opportunity, is shrinking fast, which means that the investment in early years really has to be ramped up so that this generation, and I'm obviously instrumentalizing this, but that's the reality, the way the dependency problems happen, is that this younger generation has to become adequately productive and hence move to a higher income earning category so that they can take care of their elderly who are and the rising care burden of the country. So that's why it's a very important gap in Nepal's social protection landscape. So and this was backed with several other pieces. You know, for example, we obviously looked at all the social sectors, what was happening to the budget. We tried to establish the linkage, as we had said during COVID. We also looked at what was happening to income, to deprivations. So all that was brought together. And what did we do with it? We actually had a very good advocacy plan. And I think we were lucky in the sense that the agency through which we were collecting the data, the Child Family Tracker, they also had partnership with 80 media agencies, which means that whenever data came out, which was about once in 40 days or 2 months, now we are doing it on a quarterly basis. But in the first 1 year, it was about 40 days, just in roughly speaking. There were 6 rounds of survey in the first year of COVID. The moment the data came out and it was disseminated and shared with the government, and you will see the pictures over here, and we organized a number of e-conferences at national level, but also we then went down to the provincial and the sub-national level. Zoom gives us that capacity to kind of, link very cost effectively, left, right, and center, vertically and horizontally. So after we had kind of officially launched the data, it was quickly picked up by the media, and hence the enabling environment and the public opinion was shaped using the data that we were getting. So we did, the next slide is about more of these, and you can see the EU ambassador, Nina is there, she's there in one of the pictures over here, with a lot of emphasis on e-conferences and advocacy, because obviously we do not generate evidence to sit on that. We generate evidence so that we can push it out as soon as possible to the policymakers and to the public in general through the media, as we were doing. Here is just a few examples of the take up of some of these events. And so, for example, social protection budget brief or social budget brief launch reached just 20,000 people. There's some numbers, in fact, in millions. Social budget brief launch, which was held, reached 1.6 million people, and so on and so forth. This is just one snapshot of the statistics, which basically underscores the importance of social media, advocacy, communication, and visibility, but overall about relaying and getting the evidence out into the public. That's very much part and core of the strategy that we deployed. Okay, so do we see some results? I think we do. And this again is based on our own UNICEF Nepal analysis. And you'll see that the first graph, which is the graph at the top, there the slope which captures the relationship between the multiple poverty rate, multidimensional poverty rate, and the per capita expenditure of social protection is rather flat, right? It's not very strong. But see what happens in the bottom graph. It has become much sharper. So as the poverty rates go up, the per capita investment or allocation of social protection has gone up. So that's a very good result. And what we will say is that we kind of harped on this issue again and again, the fact that the relationship between poverty and per capita expenditure is not strong. And we very much stuck out our neck many a time, and we stuck to our ground and stuck to our guns. In fact, what we can always say is that, we can always claim attribution. It's not only because of us. And if I haven't mentioned, I must mention here that all our advocacy, or at least a substantial part of our advocacy, was delivered in partnership with EU, with the World Bank, with FCGO, and other partners. So we will just say with all modesty that we can claim some attribution. Also to say that this UNICEF analysis is pretty much the only one, I would say, which was kind of put out in many of these conferences and fora. What else happened? And this is an important one, and in fact goes back to the title of the slide. So Nepal, very, very importantly, not only maintained its social protection investment, but actually increased it. And mind you, this is not one-off increase, which many countries did, right? Many countries came up with COVID cash response and in-kind response. And Nepal did the in-kind response as well, which I haven't considered here because that was an emergency response. Here, this talks about ramping up of the developmental social protection program in the context of crisis. And for example, the greens are the 11 districts which was pre-COVID. And the blues are the 14, just the opposite. The blue are the 14 districts pre-COVID, and the greens are the 11 districts which were added in the context of COVID when Nepal was facing a severe fiscal crunch. And I think this all happened because of the reasons that I'll just come to after this. What also has happened In the beginning, Nepal was very reluctant about using cash transfers, but we kept up our advocacy, all these arguments around cash enhancing autonomy, etc., etc. I see Aristotle is looking a bit worried. Okay, I'll be wrapping up. Okay, but now Nepal government has announced actually cash transfers to 500,000 families. So that's again a great result. Now, so how did this happen? As I said earlier, social protection is quite well entrenched in the policy landscape, in the constitution. But what we also did is that we worked with Nepal to get it integrated very well in the new development strategy, which is the third bullet point here. We also worked with the government, sorry, the fourth bullet point. We also worked with the government to develop an integrated social protection strategy to which we kind of referenced when we were making our advocacy. So our advocacy was always referencing to the policy commitments that they had, which is not rocket science. We also built a case for how, and this is the case, how investing in social protection actually accelerates recovery. And this graph comes from a research that we did with development pathways, right? And we shared this in several fora. Lessons on financing. It's great that social protection of Nepal is tax funded. So kudos to Nepal on that. But there is a challenge that because all of it is tax funded, so when kind of revenue dips in because of crises like this, there's a danger that, Nepal may not be able to maintain it. But so far, so good. Obviously, our continued advocacy is for broad basing it, ring fencing some of these things, maybe some kind of cess for expanding, especially the child grants. Financing options remain pretty much stock and standard. Obviously, it's a healthy percentage of GDP, but as the GDP rises, even if they maintain the same proportion, which is a 5%, there'll be greater fiscal space. Donors are also thinking of increasingly giving more resources. In fact, we are working with EU to develop a project on gender empowerment, and one of the arms is social protection. Technical support, again, continued technical support from EU, which will help establish the results for the social protection programs and hence enhance the political ownership. Final thoughts. This is the second penultimate slide. It's very important that we go jointly. We don't go solo. So World Bank, FCDO, etc., etc. Dissemination, enabling public environment and policy dialogue is absolutely key. Very close, strategic, and flexible and scalable partnership with EU has proved to be quite useful for us. In conclusion, in Nepal, the challenge remains that of allocation, equity, and efficiency. And in this whole context of where we are trying to reimagine a post-pandemic better world for children, it's very important for us to link this back to the green, inclusive, resilient development, an agenda on which World Bank, National Government of Nepal, FCDO, EU, and UNICEF are all joined up. So these were a few insights from what's happening in Nepal. Thank you so much for listening, and happy to take questions.
Thank you so much, Usha. And yeah, great example of Nepal. And I think we are a bit over time almost. And then we'll just jump now to what we are doing at local level. So we started up there at global level, then we had a deep dive in countries. Now we're going to what we're doing at local level with the Global Coalition for Social Protection for FLOR. So Bart, the floor is yours.
Yes, thank you so much, Aristide, for passing the floor to us. Good afternoon and good evening, dear colleagues joining us today in this webinar. Thank you so much for hosting, especially the colleagues also from socialprotection.org for facilitating. And thanks a lot, of course, for all the previous speakers who have come up already with some very interesting elements that make up this very specific and unique program, and in which indeed the Global Coalition for Social Protection Floors is also one of the co-implementing agencies next to the ILO and UNICEF. And I would say that indeed most of us here around the table know the ILO, know UNICEF, know the European Union, as they are big intergovernmental organizations. I guess the Global Coalition is less well known. So I am here today, together with my colleague Uziel Twagilimana. We are both working for WSM. It's a Belgian NGO, but we are here on behalf of the Global Coalition for Social Protection Floors. This is a big coalition, civil society coalition, bringing together civil society organizations and trade unions from around the world. We're about 100 nowadays. We started in 2012, right after the International Labour Conference, during which the ILO and its constituents adopted Recommendation 202, the recommendation that actually requires governments and social partners to put in place national social protection floors as soon as possible. And the coalition has made it its task, mainly at international level, to advocate and keep the topic of social protection high on the agenda, political agenda, nationally, continentally, but as I said, mainly for the global coalition at international level. We can move on to the next slide, please. Speakers have already underlined that indeed in this unique program, in this unique setup, we are trying to make the link between social protection and public finance management. And many of the speakers, including Dörte, have underlined that if you really want social protection to become a reality, you have to make sure that there is sustainable long-term funding, financing available. And so one of the key features that we're trying to work on, as Tomo and Celine have pointed out, is to make sure that there are budgeting processes which are effective, based on evidence, that we make sound diagnostics, of course, but that they're also inclusive. And this is where indeed the specific added value of the Global Coalition comes in, because how do you ensure that a budgeting process is indeed inclusive? Budgeting or any other policy process for that matter. We believe, as a global coalition of civil society organizations and trade unions, that we need to be part of the discussions that are taking place, whether it is about how to establish a social protection floor or how to seek the necessary revenues and how to allocate these and make sure that there is sufficient long-term investment in social protection. So we would like to be effectively and structurally involved in the whole process. We can move on. Indeed. So what we're basically asking within our larger work globally, but specifically also in this program, that there are mechanisms, institutionalized forms of dialogue where indeed civil society and trade unions can indeed sit together with national governments, with the development community, ILO, UNICEF, but perhaps also other organizations, to indeed see that social protection policies and the financing or fiscal policy that have to go with them are indeed reflecting the needs of the people and communities concerned. As Aristide said, we're indeed going towards the ground level, and it's indeed there that we are speaking of all those people that today, still today in 2021, remain excluded of social protection systems worldwide. Earlier this year, in September, the ILO released its World Social Protection Report, and I think the numbers remain staggering. Over 4 billion people remain not covered or insufficiently covered by social protection systems. So there's lots of work to be done. And so what many of the organizations of the Global Coalition try to do, including WSM, but Oxfam, Bread for the World, HelpAge International, the International Trade Union Confederation, and many more, is organizing these people and communities at local level, make sure that they can work together, different organizations with different expertise, with different constituencies as well, some organizing women, others organizing indeed children, others organizing in rural communities, organizing informal economy workers, etc., and make sure that they can make up a voice with which they can defend the interests of that larger constituency and defend that voice indeed in institutionalized forms of dialogue with national governments, with economic actors, because let's not forget that also the private sector has an important obligation in this field, and this at all levels, from the local to the international level. we can move on. Of course, what we understood as soon as we got involved in this program as a global coalition, we needed to build our internal capacity on public finance management. Because as I said, we started after the ILO adopted recommendation 202 on national social protection floors. Most of us really have some idea and a vision about what social protection is, what its aims are, how you can actually build national, largely supported, comprehensive social protection policies. But we also were aware that our capacity in terms of public finance management was far more limited. And so we set ourselves to work, and we asked some experts from within the coalition to actually develop a training manual. And so by early 2021, 2 of those experts had developed a manual. And in February, then we convened a first real training session with the country teams in the countries where the Global Coalition is active, because that's perhaps also good to underline. Whereas this program intervenes in 18 different countries, as Tomo has explained, we actually only work, WSM, HelpAge International, and Oxfam in 4 countries, Cambodia, Nepal, Senegal, and Uganda. And so those teams, we brought them together for this, let's say, global training session, about 20 of us, to get a better understanding of public finance management. That was to kickstart a process of internal capacity building also in the country. So right now, in those 4 intervention countries, our national teams working with national coalitions of civil society and trade union organizations are now replicating the same training, but of course, tailored to the specific context in the country, so they can deepen certain concepts, taking into account the local realities. Also undertaking such training in the local language, which also, of course, can sometimes be a hurdle. Finally, we were also very happy that this year, ILO, UNICEF, and the Global Coalition were able to organize a global training as well, where we didn't have just civil society and trade union organizations, but where we could also actually interact with experts on public finance management of the ILO, of UNICEF, and of the European Union. I think this mutual exchange was very important to build also our capacity, a training which started mid-October and was actually finalized yesterday. Before turning the floor to my colleague Uziel, who will speak about Senegal and how our colleagues in Senegal have really tried to build their capacity, what are some of the lessons that we have learned? I think we call for effective and structural participation in these different processes. And of course, that's work in progress. It knows its ups and downs. Both at country level, we have noticed that it wasn't always easy to get our place around the table. But nowadays, we can state that in the 4 countries, we are indeed seen as a full partner and a full implementing agency. So that is really great. And thanks to all the colleagues for facilitating this. But also at national level, bringing together different civil society organizations, because everybody may have a different vision or may put certain accents or emphasis on different aspects of social protection. Here, we're really trying to build larger civil society and trade union coalitions that can really bring a stronger voice to the table. And so, as I said, it's with ups and downs that we're trying to do this. Also, the internal capacity we have started, I think those first trainings, both globally and now at national level, have really certainly bore their fruits, but we will continue to do some to get stronger and to get a better understanding of the very vital link between public finance management and social protection. The spirit is there, and we're happy to continue. And let us now turn to Senegal, where my colleague Uziel can step in and provide you some concrete examples of how this is being done in one of our intervention countries.
Thank you very much, Bart. My presentation will be in line of the introduction you have just made, but also the presentation by Alex and the general remarks by Dorothy. First of all, I would like to say that I make this presentation on behalf of more than 25 civil society organizations, trade unions, some of them being umbrella organizations involved in this theme of social protection. This platform includes the INSPIRE International Network of Social Protection in Senegal with 14 organizations, umbrella organization of people living with disability, the Rural Workers Women Organization, Informal Economy Organization, and the National Council of the Elderly, and many other representative civil society organizations. Allow me to say also that there is very good cooperation and complementarity between ILO, UNICEF, and the Global Coalition of Social Protection, as you will see later on. Slide. Yeah, as Pat was saying, we have conducted several PFM capacity building activity in Senegal through various channels. Slide. The first channel is through intercontinental training, as the one Bart was describing before. I will not develop it more. Secondly, slide, is through national workshop that organized with ILO and UNICEF. ILO has organized several training on social protection, on public finance management, on fiscal space for social protection, even on advocacy, geared only to civil society and trade union organization. And also these training were benefiting all projects that are funded by the European Union on behalf of civil society and trade union organization. Thirdly, slide, there have been specific training by the Global Coalition of Social Protection flows through WSM. Why these trainings? First of all various organizations needed to get a harmonized vision on the social protection, and also to get coherent strategy for extending social protection to the most vulnerable. Also, they needed training and advocacy for advocacy, and these various training also, they have capacitated them for awareness raising on PFM and social protection without forgetting social accountability. Slide. Through these various channels, slide, please. We are to identify several themes for advocacy. Advocacy first to the central government. Alex has talked about the 8th option, possible option for civil society organization, trade union in Senegal. They have put emphasis on 3 of the 8 options. One of them is to increase tax revenue as one of the channels for increasing fiscal space. And the second one would be the reallocation of resources that are now geared toward the subsidies that are given to subsectors, but do not benefit the poor, but benefit more the wealthiest part of the population. And also, it is the extension of social protection to the informal economy through what Celine has called formalization of informal economy. And also, apart from this aspect of reducing tax exemption, there is also how we can use, for instance, corporate social responsibility mechanisms so as to mobilize more resources. Then we make advocacy at national level around those topics, but also on a law, so that the social protection be institutionalized is regarding the future governments. Secondly, advocacy is geared toward the local government. Pretty soon there will be election for local government officers. And now civil society organization and trade union would like that these future leaders take commitment for extending social protection to people living with a disability, to senior citizens, to children, including children in Quranic schools that do not benefit from social protection. But also the government has committed to subsidizing the initiative by community called Mutual Health Organization, but there is no regular payment of the commitment by the government. Would like that this local government support civil society, first of all, in inscribing a budget line in their budget for supporting social protection at local level, but also being our allies when we advocate with the central government. With the central government also, we cannot forget that we are advocating also, making advocacy toward the parliament toward the sectorial ministers, but also toward the Minister of Finance. And strategically, we have asked the Minister of Finance for capacity building to train civil society organization on program budgeting, budget-oriented program, including the program social. This is one of the strategy so that we can get to know each other, that can increase our capacity of influencing. The third aspect is mass communication and sensitization. As trade unions and the civil society organization, we have elaborated several tools, including banners, media through the community radios, pamphlets, flyers, but also having short videos that we utilize through social media for sensitizing the larger public on this topic on PFM and extension of social protection to the most vulnerable people.
Thank you very much, Uziel. I think we would like to learn more, of course, but I think we need to keep a few minutes for the Q&A to answer the questions. So I will quickly, yeah, thanks a lot for the presentation, and I will quickly hand over to Celine for part of the discussion, answering some of the questions and learning together. Celine.
Yeah, thank you very much, Aristide, but especially a great thanks to all our speakers. This was extremely, extremely rich and interesting, and really to see that all these theoretical concepts are put in practice at country level, and this strong participation also of the civil society, trade union, and the other stakeholders. It's really interesting. Unfortunately, because of time, I will pick only 2 questions from the long list we have. And I think there's one question for you, Usha, that it's particularly interesting. You mentioned the social protection budget brief. Could you please explain? I saw you post the link in the chat, but could you please, in really 1 minute, tell us what it's about? Why is it useful? How do you use this tool with the country? Thank you.
All right, so social budget brief basically means that looking at budget allocation in key social sectors like education, health, nutrition, child protection, and WASH. And within that, there is a social protection budget brief. It's available on UNICEF website. I have posted the web link. And why it is important? Because this tells us about the trend. It compares the social budget vis-a-vis the hard infrastructure, the defense, the other administrative thing. You know, it tells us about the government's policy and how far it is prioritizing, for example, the human capital development, because social budget is really in those sectors which are related to development of the human capital. That's why it's important to understand what's happening in those sectors. Yeah.
No, thank you very much, Usha, for summarizing all of this great work. And indeed, the brief that you posted are really illustrative on how these tools can be powerful for advocacy as well, advocacy with our ministries of finance, including. And talking about advocacy, Alex, you responded in the chat, but I wanted also for you, if you could share a little more on what's happening on the advocacy agenda in Senegal, and even happening now live when we are talking. Thank you, Alex.
Yes, of course, Celine, and thank you, Costanza, for the question. So it's important to mention also that it's not just about advocacy now, and actually a lot of the results are already being translated into reality. For instance, some of the programs that were selected by the working groups are already being piloted or implemented or extended right now. And this started last year already. When it comes to advocacy, well, there are several things. There is a lot of capacity building that we are leading here in Senegal, as much to disseminate results from these studies among institutional and technical partners, as well as civil society. And then there are also broader events going on. And one of them is actually a conference, national conference around social protection that is taking place right now. It's organized by Ministry of Labor, and the President of the Republic is attending. And this conference is centered this year. It's called the Social Conference, but its main topic this year is social protection. And the Ministry of Labor will actually be presenting the results of both studies, so the global review of the social protection system and the financing options, fiscal space analysis, and impact assessment to the audience today and tomorrow. And this, I think, will allow a better dissemination of results, better ownership of results also by national partners, and create an impetus to really delve into financing options after this.
No, thank you very much, Alex. And I think your last word is great also to conclude this session. And I apologize if I could not pick on the question. I'm sure Usha and Alex can quickly post the answer. But your last word, Alex, was really good to conclude this discussion, to really remind us how social protection has been important in responding to the COVID and now has been elevated at the highest level of priorities of the government, including, as you said, with the President Macky Sall in Senegal now, reminding that his commitments to increase social protection in the country. It's really great. With this positive word, Aristide, I give you over the floor for the last concluding remarks. And thank you again for all the questions and the panelists. Thank you.
Thank you very much. I think maybe before concluding, I think there is an interesting question on the poverty focus. And I don't know if Daughter is still there and would like to take up on this one.
Yeah, sure. No, thank you. Super quick because you're already beyond the time schedule. Thanks for giving me the opportunity. Look, I think it's an extremely important question you put there on the poverty focus, and it perfectly links in what you just mentioned, Celine, as well, and was mentioned throughout the seminar. This is about really keeping the momentum of the increased interest on social protection, right? And what you just say at the highest level, fantastic. And but I think this has been in the literature as well. So we have a lot of short-term responses right now, even so very much poverty focus. I'm fully d'accord, but we should keep the medium long-term perspective, which we already had before, and we need to continue having, right, in keeping the poverty focus. And I think by including, we have seen this throughout the world, many countries now, they include the shock responsiveness or preparedness inside, which has a strong impact on the poverty, of course, of the population as well, how people can be better protected upfront. So really to make sure, because we had a lot of cash transfers and all this, no, throughout COVID, but this, I mean, of course, could be still there, but we need to have medium long-term perspective and keeping the poverty focus throughout the next years at systematic national system building for social protection. Thank you very much. I would conclude here. Thanks for listening.
Thank you very much, and thanks to all our speakers. And sorry and apologies to all of you for going above time and shortening the learning together session. So, but at least we had some great presentations, some great deep dives into the countries. It was really difficult not to listen to all the presentations all together. So, of course, there are unanswered questions, and we will try to address those questions, maybe in the slides that will be shared with all of you. So, or maybe posted on the socialprotection.org platform. So we are now at the end of our meeting, and then with important takeaways, we heard the importance of advocating, working on public finance and linking it to social protection. So I know many institutions and many people involved in this program would like to learn more. And I would like to tell you that we are organizing, this is only the first webinar out of a long series of webinars that we plan to have throughout the year to come. So please keep tuned in, and then we will be having some webinars on gender, disability, shock responsive social protection, how we deliver social protection on the ground with always the public finance management lens. So stay tuned in, and then we will be in touch in our next webinar. Thanks a lot, and happy Thanksgiving to those who celebrate.
Thank you, everybody. Goodbye.
Thank you, everyone.
Bye.
Goodbye.
Great.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.